The hospital waiting room smelled of antiseptic and anxiety. Fluorescent lights buzzed softly, casting a cold glow over rows of stiff chairs. Patients sat quietly, some lost in thought, others scrolling aimlessly on their phones. Among them was Celia Harper, a middle-aged black woman, clutching her handbag and shuffling nervously as she waited for her appointment. Her leg had been causing her pain for weeks, sharp and relentless, and she had finally gotten an appointment with a specialist she hoped could provide relief. When her name was called, she stood and followed the nurse down the narrow corridor, trying to push down the nervous flutter in her stomach. She reminded herself, "Stay calm. Speak clearly. You deserve care." The room they entered was bright and sterile, but it carried an air of authority. Behind the desk stood Dr. Hamilton, a man in his early 40s, sharp suit under his lab coat, expression stern, eyes flicking over paperwork more than patience. "Good afternoon, Ms. Harper," he said flatly, barely looking up. Celia attempted a warm smile. "Good afternoon, doctor." "Thank you for seeing me." Dr. Hamilton barely acknowledged it. He gestured to the examination chair. "Sit. Let's get this over with." The words stung more than she expected. The dismissiveness, the abrupt tone, it felt different somehow, like she was invisible, yet simultaneously under scrutiny. As she positioned herself in the chair, Dr. Hamilton began the exam, his hands professional but his demeanor cold. "So, what's the problem?" he asked, eyes flicking toward the clipboard as if the details didn't matter. "My knee. It's been swelling and hurting for weeks. I can barely walk some days," Celia explained, her voice calm but firm. "Huh," he muttered, barely glancing at her. "You should have taken better care of yourself. Maybe you're just out of shape." Celia froze. Out of shape? She had been active, walking miles, even doing light exercise when her schedule allowed. Her heart sank. She had anticipated a doctor who would listen, but instead, she faced judgment. "I assure you, doctor, I've maintained my activity, but the pain has been persistent," she said carefully. Dr. Hamilton huffed, scribbling something on the paper. "You probably just need rest, ice, and maybe some anti-inflammatories." "Nothing serious." Celia's eyes narrowed slightly. "I'd like a proper assessment, including an x-ray. I'm in significant pain." His head snapped toward her, a flash of irritation crossing his face. "Really? You think I haven't done this 100 times? You're exaggerating, most likely." She bit her tongue. Every fiber in her body wanted to defend herself, but she knew that arguing alone might make things worse. Instead, she simply nodded. "I understand, doctor. I would like an x-ray to be thorough, though." The doctor's eyes rolled. "Fine. Let's see if this really requires medical attention. But don't expect miracles." As he left the room to request the imaging, Celia leaned back in the chair, letting out a breath she hadn't realized she was holding. She felt her face flush, part from embarrassment, part from frustration. "Is this really how patients are treated?" she thought. The x-ray machine was cold and impersonal. The technician, thankfully courteous, guided her efficiently, but the lingering judgment she had felt from Dr. Hamilton weighed on her chest, like a heavy stone. By the time she returned to the exam room, she was exhausted. Not just physically, but emotionally. She sat quietly, staring at the sterile walls, feeling the sting of indignity. Moments later, Dr. Hamilton returned with the images. He glanced at them briefly, barely speaking to her. "You have some swelling, mild arthritis. Nothing to worry about. You can manage with these medications and avoid strenuous activity." Celia's jaw tightened. Mild arthritis? She knew her body. She knew something more serious was happening. "Doctor," she began softly, "I think we should explore the cause more thoroughly. This has been getting worse for months, not just recently. Can we consider further tests?" He looked at her, his eyes narrowing. "You're probably just seeking attention. Some people like to dramatize their pain. There's no need to overcomplicate this." Celia's chest tightened. The words were a mixture of dismissal and subtle judgment, and she felt the color rise in her face. She had expected empathy, not condescension. Just then, the door opened abruptly. A tall young man entered, his presence commanding. His sharp eyes scanned the room immediately. "Mom?" the young man asked, his voice calm but firm. Celia's eyes widened. Relief and surprise washed over her. "Ethan, what are you—" He closed the door behind him. "I'm here to make sure they're treating you properly." Dr. Hamilton looked up, startled. "And you are?" "I'm her son," Ethan said. "And I don't like what I'm seeing." The air shifted. Suddenly, the subtle dismissal and judgment in the room felt heavier, more visible. Celia's heart swelled with gratitude. Her son's presence was more than comforting. It was a silent but powerful reminder that she was seen, heard, and valued. Dr. Hamilton's eyes flicked between mother and son. His professional mask remained, but the tension in the room was undeniable. Ethan didn't speak yet. He simply observed, taking in the subtle arrogance in the doctor's tone and posture. And in that quiet, Celia felt something shift, a sense that her voice, her pain, and her dignity were about to be defended. She sat back, letting the relief wash over her. For the first time that afternoon, she felt that perhaps justice might have its moment, not just for her, but for everyone who had been dismissed, belittled, or ignored in that sterile, judgmental room. And then Ethan finally spoke. His words measured but sharp. "Let's do this properly. My mother deserves real care, not assumptions." Ethan's presence filled the room like a sudden gust of wind, scattering the subtle arrogance that Dr. Hamilton had maintained. The doctor shifted uncomfortably behind his desk, tapping his pen on the table. "My son," Celia whispered, a mixture of gratitude and embarrassment in her tone. "You didn't have to come." "I did," Ethan said firmly. "You've been patient long enough. You deserve proper care." Dr. Hamilton cleared his throat, trying to regain composure. "This is a professional setting. You're interrupting a medical consultation." Ethan didn't flinch. "No, you're interrupting professionalism by treating my mother rudely and dismissing her concerns. I'm here to make sure she is heard." Celia's heart swelled, relief mixing with pride. Her son, strong, composed, and fearless, was standing for her in a way she hadn't anticipated. The doctor exhaled slowly, clearly irritated. "I assure you, her condition is minor. She's overreacting." Ethan's eyes narrowed. "Minor? You've been dismissing her pain, minimizing her symptoms, and judging her before even listening. That's not minor. That's unacceptable." Celia felt tears prick her eyes. For weeks she had carried this pain alone, enduring judgment silently, trying not to seem dramatic or difficult. But now, with Ethan beside her, she didn't feel so isolated. Dr. Hamilton tried to regain control. "I have experience. I know what I'm doing. You don't need to interfere." Ethan leaned forward slightly. "And I have experience too. Experience with injustice, with watching people be belittled and ignored. My mother is not one of your statistics. She is a human being, and you will treat her as such." A hush fell over the room. Even the nurse who had assisted earlier seemed tense, as though witnessing a subtle battle of authority and morality. Celia opened her mouth to speak, but closed it again, letting Ethan continue. The power of his words gave her courage. She realized that sometimes one voice isn't enough, but two, united by love and respect, can demand change. Dr. Hamilton's hands tightened around his clipboard. His professional mask was slipping. The arrogance that had allowed him to belittle Celia was now confronted directly, publicly. Ethan gestured toward the X-ray results. "Let's look at these together, step by step. No assumptions, no dismissals." The doctor hesitated but finally pulled up the images on his computer. Ethan studied them carefully, pointing out subtle swelling and irregularities in the knee joint. "This needs proper evaluation," he said firmly. "It's not just arthritis. Something more is going on." Celia watched her son, amazement and pride mingling with exhaustion. She realized she had underestimated the impact of having someone stand for her. The fear and humiliation she had felt minutes ago began to fade, replaced by validation and a glimmer of hope. Dr. Hamilton muttered something under his breath, clearly frustrated that his authority was being challenged. Ethan ignored him and continued to review the medical information, asking detailed questions, comparing with the patient's history, and insisting on additional imaging to confirm the diagnosis. Finally, after several tense minutes, Dr. Hamilton exhaled and leaned back in his chair. "Fine," he said, tone begrudging. "We'll schedule further tests." "I see your point." Ethan didn't smile. He didn't need to. The room now had balance restored, not because of anger, but because justice was being acknowledged. Celia, trembling slightly, finally found her voice. "Thank you," she whispered, looking at her son. "I didn't know I could feel this relieved." Ethan placed a hand on her shoulder. "You deserve this, always, never. Let anyone make you doubt your right to proper care." The nurse who had assisted earlier gave a small nod, quietly acknowledging the significance of what had just happened. Even Dr. Hamilton's demeanor had changed subtly, a recognition, perhaps, that the world had caught up with his behavior. By the time they left the consultation room, the tension had lifted slightly. Celia felt lighter, though her knee still throbbed with pain. But the emotional burden, the silent fear of being dismissed, the humiliation of being judged, had eased significantly. In the hallway, as they passed other patients waiting for appointments, Celia noticed subtle glances, some of sympathy, some of curiosity. She realized the power of witnessing. People had seen injustice, and sometimes seeing was the first step toward change. Ethan squeezed her hand. "You're not alone in this," he said softly, "and we'll make sure you get the care you need." Celia nodded, taking in the sterile, bright corridor, but seeing it differently now, as a place where courage, advocacy, and love could intervene in moments of bias. She had gone into that hospital expecting care. Instead, she had faced judgment. But with her son's presence, she had reclaimed her voice, her dignity, and her right to proper treatment. And for the first time in weeks, she felt a renewed sense of hope, that her pain would not only be addressed medically, but that her humanity would be recognized as well. The follow-up tests were scheduled promptly, but the tension from earlier still lingered in Celia's mind. Every step down the hospital corridor felt heavier because of the memory of the dismissive tones, the cold stares, and the subtle prejudice she had faced. Yet she wasn't alone this time. Ethan stayed by her side, unwavering, a constant reminder that her voice mattered. As they waited for the results, the doctor finally entered the room, clipboard in hand. This time, however, his demeanor was different. Gone was the arrogance, replaced with a restrained formality. "Ms. Harper," he began, his voice carefully neutral. "We've reviewed your tests thoroughly." Celia and Ethan exchanged a brief glance, the tension in their shoulders easing slightly. "You have a tear in your meniscus that requires attention. It's manageable with minor surgery and physical therapy," Dr. Hamilton continued. "Had we caught it earlier, the treatment would have been simpler. I apologize for underestimating your symptoms earlier." Celia felt a mix of relief and frustration. Relief for the diagnosis and the path forward. Frustration for the unnecessary stress and dismissal she had endured. Ethan's hand squeezed hers gently. "It's okay, Mom. The important thing is they're listening now." Dr. Hamilton hesitated, clearly conscious of the weight of the moment. Then, in a tone that suggested he was addressing more than just the room, he said, "You were right to insist on further evaluation. Your persistence ensured the correct diagnosis." Celia's eyes widened slightly. This acknowledgement, while overdue, meant something. It was validation, the recognition that her voice, her experience, and her insistence on proper care had made a difference. The doctor continued, "I want to assure you, going forward, that this office will be more attentive. Bias, whether conscious or unconscious, has no place in patient care. You should never feel dismissed based on assumptions about your health or about you as a person." Celia nodded, absorbing the words. They didn't erase the past, but they laid the groundwork for accountability and change. Later, as she sat in the hospital lobby filling out paperwork, she noticed the subtle looks from other patients. Some were glances of curiosity, some of admiration, but all seemed tinged with awareness. Word travels fast, and what had started as a private struggle had now become a visible story of resilience and advocacy. Ethan leaned closer. "Mom, you were amazing today. You didn't let him intimidate you. You stood your ground." Celia smiled softly, her emotions finally finding release. "I didn't stand alone," she said. "You were here." That made all the difference. As they walked toward the exit, Ethan suggested they report the incident formally to hospital administration. "This wasn't just about you. It's about everyone who might face the same thing," Celia agreed. "If my experience can help someone else get proper care, then it's worth it." At the administration office, they filed a formal complaint detailing the earlier behavior. The staff listened carefully, taking notes and promising a thorough review. The hospital assured them that corrective action would be taken and that staff training on unconscious bias would be reinforced. Walking back to the car, Celia felt lighter, the lingering weight of humiliation replaced by a sense of empowerment. For weeks, she had endured pain in silence, both physical and emotional. Now not only was her medical condition addressed, but her dignity had been restored. Ethan glanced at her. "Mom, the world needs more people like you. standing up, insisting on respect, demanding the truth. She smiled, warmth spreading through her chest. And it's people like you who remind me I'm not alone. The sun was beginning to set, casting a golden glow over the city streets. Celia's limp was still there, a reminder of the injury she had endured. But the metaphorical weight of being underestimated and judged had lifted. She realized that justice wasn't just about diagnosis or treatment. It was about being heard, being seen, and being valued as a human being. Later that evening, as she reflected on the day, she tucked the small hospital receipt into her wallet. It wasn't just a piece of paper anymore. It was a symbol. Proof of persistence. Proof of being recognized. Proof that the truth can prevail, even when others attempt to dismiss it. Celia hugged Ethan tightly before bed. "Thank you," she whispered. "For everything." He smiled, ruffling her hair. "No thanks needed. You did the hard part." And in that quiet moment, Celia felt something shift deep inside her. A new kind of strength. The strength to face the world without fear of dismissal, the courage to insist on being treated fairly, and the understanding that sometimes having someone by your side makes all the difference. The hospital had witnessed her struggle, and now it had witnessed her courage. The doctor, the staff, the patients, all were forced to see what happens when persistence meets truth. Celia Harper had entered the hospital expecting care. She had faced judgment instead. But with her son's presence, her voice, and her unwavering insistence, she left not only with a plan for healing but also with the knowledge that dignity, when demanded, cannot be denied. The sun set fully now, bathing the city in golden light, and as mother and son walked home together, Celia felt the weight of the day lifting. She had been seen. She had been heard. And she knew without a doubt that justice, small, personal, and meaningful, had been served.